Assalamu alaikum. Welcome to another episode of our health show. Today we have with us again Professor Karim, who is a professor at Mimbili University and a pediatrician. Welcome to our show, Professor.
Thank you very much. I'm delighted to be again with you this time.
Today, the topic for today is something that many of us don't know about, or many of us are unaware about, its importance, its deficiency, the main vitamin, vitamin D. So as we start, like many of us know there's so many kinds of vitamins, there's A, B and all of that. Now when we talk specifically of vitamin D, what is the role of that vitamin D in our body?
Thank you very much, Fatema. This is a very important vitamin, and I can consider that it has been a neglected vitamin until of recent, when a lot of research and findings indicate that probably this is one of the most important vitamins. This vitamin D is important, as we know from olden times. Our grandparents and grandmothers, they used to tell us to take fish, and they used to tell us to play in the sun, and they used to give us cod liver oil tablets or capsules. And they knew that there is something to do with the bones you have with vitamin D. That was the traditional way of knowing what is vitamin D. But we know from medical school also that I have studied when I was an undergrad. The role of vitamin D, which was classically taught, was vitamin D is responsible for absorbing calcium from the gut and preventing reabsorption or softening of the bones. So making bones mineralized with calcium and having more calcium absorbed from the gut. And we knew that its deficiency was mainly related to kidney diseases and those kind of things. But we didn't know at that time, 1980s, its very important role in the body. So of late we have been seeing and we've discovered and we have read, and many research are going on to indicate how important this vitamin is.
So it's one of the most recent discoveries.
Not really recent, but in order to impress upon what I mean to say, something which is now being recognized more. Because age old we know that vitamin D has been very important in human health. But to give you an example, for example, we had like 1,000 papers published in the year 2000 for vitamin D related research. But in year 2000, 10 years down the lane, year 2010, there are 4,000 papers published. It indicates that there is a surge, there is an uprise on knowing more and more details about vitamin D. And it has been discovered, therefore, that this is probably one of the most important vitamins in the body.
Being the most important vitamin in our body, that means that its deficiency could lead to various kind of diseases. What are some of the diseases that could result as a result of its deficiency?
Before we talk about the deficiency, maybe we can say what is its role in our body. And the role in our body, vitamin D, it has multiple roles. If you take at a very micro level, vitamin D is responsible for immunity, collagen, functions of the white blood cells, functions of myelin, functions of the eye, anywhere where you will have anything to do with any fatty acids, anything to do where the body requires some amount of natural fat, any place where there will be required any calcium and phosphate metabolism, vitamin D will be required. So you will find it is required from things ranging from the brain, so you can take from head to toe, what I described from head to toe. So if I talk about head, a proper functioning central nervous system, developing brain in the fetus, eyes and optic nerve. You have skin integrity, cancers of various types, bones, heart diseases, skin disease such as psoriasis, nails. You go down the gut, reproductive function, muscle pains, back, muscles itself, back pain, knee pains, ankle pains, and all kinds of things which are associated with collagen, fat, and nerves.
So how does it do this function? Like how does it help in this fatty acid, calcium, and phosphorus?
So it's intricate mechanism. It's intricate mechanism in the liver, in the kidney, in the tissues, in its role with parathyroid hormone, in its role with phosphate, in its role with other vitamins. It combines all those roles together, and it maintains that integrity of the body. In fact, if I would quote one of the article I read, which says that if Pauling, Linus Pauling, the one who discovered vitamin C for scurvy, and he propagated about vitamin C's importance, he says if he would have been alive, he would have forgotten about vitamin C, and I would have said vitamin D, vitamin D.
Which shows how important it is.
Very important. So many research have been done. There are certain researchers who say, well, you know what, there isn't any direct cause and effect relationship of vitamin D. For example, give vitamin D and you will cure the disease. Make deficient vitamin D and you will create the disease. There isn't any clear-cut A plus B is equal to C link. But all the links indicate that, for example, if you have cancer, your vitamin D levels are low. If you have cancer and you have low vitamin D levels, then the likelihood of your being successfully treated because you have low vitamin D is lower than those who have cancer and normal vitamin D. Their success for being treated is better. Tuberculosis, very common disease. If you have tuberculosis, your vitamin D level goes low. It doesn't mean that low vitamin D causes TB, no. But it has been found from research that vitamin D low levels are seen with TB.
So mainly there is a correlation somewhere.
There is a correlation. But for those who had low vitamin D and TB, their treatment outcomes is much poorer than those who had normal vitamin Ds. The other way around, those who were having vitamin D supplements and being treated for TB, their recovery was far much better. So there is something which vitamin D does to your immune system, to your body, to your reactions, which although it is not direct A to B relationship as I said, but there is something which is really a supplementary effect. And therefore it is very essential. You see, the supplementary vitamin, or a vitamin which has got a background role which is being now seen to be very, very important. So don't get me wrong saying that if you are vitamin D deficient, then you develop cancer. Cancer people are found to have lower vitamin D levels, and those who have lower vitamin D levels respond poorly to the drugs or treatment, and therefore it is a good idea to have your vitamin D level at normal level. You get the point?
So before starting treatment, it's good to monitor the vitamin D level.
Before
because
anything,
it would
actually,
improve the prognosis.
That's right. So vitamin D is the best vitamin under the sun. It means it is the best under the sun, and it is also best obtained under the sun. We'll come to it later, I think, when we discuss about this. So basically, again, when you talk about vitamin D, Actually, whether vitamin D is a vitamin or a hormone, we don't know. Most of the time, from biochemistry point of view, from biochemical point of view, actually vitamin D is a hormone. Now let me, for the sake of the audience, describe a vital amine or a vital substance which is required in the body. That is something which is required in the body which you don't have in the body and you must take. Those things are called vitamins. The name was derived from vital amines. Amines are smaller molecules of food substances derived from proteins. And therefore it was discovered and it was vital amines or vitamins. And those are essential in the body and they are not manufactured in the body. Therefore we have to take them to have them in the body. That's why they are called vitamins. Now vitamin D is unique, that you need to take, but at the same time the body can produce itself. Just like the hormones, adrenal hormone, the thyroid hormone.
The way the glands produce them.
The glands produce. And the amazing part of vitamin D is, just like the hormones, it is produced somewhere, like the thyroid, but it works all over the body. Vitamin D is produced under the skin, it is activated by the liver and the kidney, and works all over the body. That is why vitamin D may not be a vitamin, may be a hormone.
Due to its properties.
Because of its properties. But we conventionally know it to be a vitamin.
So, since we know that vitamin D is produced under the skin and it even has to be taken, what are the sources of vitamin D?
The most important source of vitamin D is the skin. Now, I can divide the sources from various age groups, and I love to start with the newborn babies because that's my specialty. Vitamin D is present abundantly in mother's milk. And a newborn baby has enough vitamin D if it is exclusively breastfed. Newborn babies don't need to be exposed so much to the sunshine to create or to produce vitamin D because they have enough reserves and stores for the first 6 months of life.
That they obtain via breastfeeding?
From the breastfeeding and milk. Any milk.
Even the formula milk?
Even the formula milk. But best to exclusively breastfeed. Premature babies, extremely low birth weight babies, their demand for their body is higher. So breast milk alone cannot meet the demand. So they need to be given supplements of vitamin D drops. Now, it was amazing, this one important thing, that we did a research on 100 babies who are low birth weight and who are being breastfed. And we found 33% of these low birth weight babies had rickets. Rickets is one of the features, we can discuss that if you have time, it's one of the features which shows the bones aren't growing well and the baby has serious problems. And we found 33% of these babies were having rickets. So when I wrote this article to the Annals of Tropical Pediatrics, and they said, oh, you must be crazy actually. How can you have vitamin D deficiency in Africa?
Where there is a lot
There is only sunshine there. There's no winter, there's no snow.
You would expect it to be in the tropics.
So how come? I said, look, these are low birth weight babies, covered, always inside. Mothers are protecting it from cold and hypothermia and things. They have always been indoors. And therefore, please give me a break. It does happen even in Africa. So it does happen right under our nose, under the sunshine. So we have plenty of sunshine, but we are poor in getting that sunshine enough because we don't realize the importance of the sun.
But covering up premature babies or babies with extremely low birth weight has been something that has been coming from a long time. Like when babies are born,
it is important to cover them, not to overexpose them because of the heat and things. But it's also important to give them some sunshine.
Okay.
And it's also important to supplement them because their demand is higher than the supply.
Then the normal
Than the
birth weight
supply,
babies.
yeah? So that is one, the source. The second source in growing children is again milk and sunshine.
Is it normal milk? Or is
Normal
it
milk.
milk that has been fortified with vitamin D?
Normal milk, sufficient amount. Milk, egg, cheese, fish. I'm coming to it. Milk and sunshine, younger growing child. Come to adolescent, good amount of milk intake, dairy product, fish, eggs, poultry, and sunshine. Adults, bigger adults, senior citizens, milk, fish, sunshine. Very old people, in old people's homes or confined to our own homes, sunshine, milk, and cheese, poultry, fish. So everywhere in all groups, sunshine, 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 sunshine. For example, in the Holy Quran, the sun itself, the sun is mentioned no less than 35 times. To an extent that Allah once even swears by the sun. So what is there in the sun? There are many other, this is a metaphor, or there may be other meanings. But for my naive vitamin D thinking brain, I think it is the vitamin D we are being told about.
Since we've been talking about the sun exposure,
Sun and sun.
but for the ladies and the girls out there, they're more worried about the tanning and all those processes. Now, for adequate amount of vitamin D to be produced in our body, for how long should one expose oneself to the sunlight?
So besides the nutrition and the dietary intake, sometimes the dietary intake is not enough for the very elderly because their absorption is poor, or some people who have malabsorption syndromes and things. So they need supplements. But when you come to sunshine, there is definitely how much exposure to sun, and whether the color of the skin matters, and whether the age matters. Yes, as far as the age, any age should be exposed to the sun. As far as skin color, the darker you are, the more you need to be exposed to get the absorption better. There is a problem now, you have to strike a balance. If you have a lighter skin, the white skinned people, there is a potential danger of sun causing them a sun harm.
The sunburn.
The sunburn as well as damage to the skin, causing very rapid repair, and therefore the DNA may go haywire and cause skin cancers. So there is a fear of skin cancers in the fair skins. And what time of the day? In the morning, Fajr time, peak afternoon, or at evening. The best sun is that one which gives you ultraviolet rays, and that is best during the early hours of the morning. You will find it amazing that I came across a hadith by Imam Ali alayhi salam. He's saying that after you finish Subuh Namaz, don't go to sleep. Get yourself exposed to the sun by doing your activities in the sun and continue earning your livelihood. Why? Why was he saying that? Again, as my very simple vitamin D thinking mind, he knew that after the sun is risen and it is bright up in the sky, he has to go out to till in the sun. He can't be exposed too much. He will have to wear his long dress. Even the men wear long dresses, and they covered their heads with turban, and they covered their neck with a scarf. So there was same exposure what men would have than women. But he exposed himself to the sun from namaz time till when the sun was out and he was out in going to work. So again, you might be thinking about, so what about us women?
Who wear the hijab.
You have time to expose yourself to sun. Expose yourself to sun before you go out to work in your hijab, before you go out to school in your hijab. There's no problem in wearing a hijab. Even the prophets wore their dresses which were no less than hijab. They wore long dresses. They covered their heads, they covered their ears, they covered their necks with all that things, and they were exposed to the sunshine. Minimal face, arms, palms, and the soles were exposed to the sunshine. And from the morning namaz until when the sun was up and about, they were exposed to the sun. They never went to sleep. So here it is. There is no question about I'm a hijabi and therefore I may not be exposed, and why is this being unfair to me that now I'm not being exposed. No,
the palms are enough.
You have enough sunshine during the time before you go out to seek your livelihood or school or anywhere else where you need to wear your hijab.
So from here we learn that the best hours are during the early hours of the morning.
Best.
And the amount of time, the duration depends on the color of your skin.
Yes.
Right? For the light colored people like the Asian skin, what is the minimum amount of time they should spend on? Because it might be like quite confusing.
For about an hour a day should be enough.
An hour a day.
It should be enough.
Okay. And how many times a week? Should it be
every
daily?
Day.
Oh, every day.
Every day.
Okay. And you said it even depends on the body size.
And the body size.
If the person is obese.
The amount of exposure. When the body is obese, therefore the vitamin D, which is fat soluble, and distribution into the body, again, the effective amount of vitamin D isn't enough. It has been found that vitamin D deficiency leads to obesity. And taking adequate vitamin D levels reduces the amount of hunger, and therefore causes you more satiety, and therefore helps you to reduce weight. So guys, don't worry. Taking a cod liver oil capsule will not make you fat. On the contrary, will make you thin, because you will look better, you will be more satiated, you will have enough vitamin D, and you will be less obese. So don't worry, vitamin Kais, I'll eat vitamins and I'll become fat. No, if vitamin D does not cause fattening. On the contrary, it reduces weight.
A very important information for our
Very
youths out there. And another thing, like vitamins, as we know, they need to be taken, right? But then there has to be there is a level at which the body needs it, right? Anything above that is toxic to our body. Now, when you talk of vitamin D, yeah. So if you spend an hour, like the minimum amount of time every day, so what if it leads to vitamin D toxicity that occurs as a result of increased production of vitamin D?
That's a very, very important question, Fatema. In terms of sunshine exposure, there isn't any over toxicity of the amount of vitamin D you will produce. The amazing part of sunshine and vitamin D is it is a very important special switch in the body, automatic switch, a biorhythmic switch. If you are exposed too much of sunshine, whatever vitamin D is produced, it will be activated in the liver. You don't need more vitamin D, your skin will not produce it. It won't cause you toxicity because of the sunshine. So there isn't any overexposure and over vitamin D production, no.
So there is a feedback mechanism.
There is always a feedback mechanism, that's right, exactly. But there is always a problem of poor production. Mm-hmm. So as far as sunshine exposure and toxicity, no. The skin color and sunshine exposure with cancers, yes, there is a problem with the white skin. In terms of toxicity with the oral supplementary intake, yes, there is a potential problem. Taking from your food, whatever will be required will be absorbed, but taking extra supplements, if you are taking normal, what you call recommended dietary allowance, which is called RDA, You will find in the boxes and tins and chocolates and everywhere it's written vitamin D, this many international units, which will comprise 20 RDA. You will find a column on RDA in the boxes. So if you see it is 20% of your recommended dietary allowances, no problem. If you are taking supplements, normally your supplements are within normal range. 600 to up to 2000 international unit supplements are within normal range and they don't cause any toxicity. One capsule of cod liver oil, it's enough and it will not cause toxicity. If you fear any toxicity, maybe 3 times a week. Normal dose will not cause any toxicity. Overdose, taking too much of it, will cause some toxicity. And the toxicity is reversible, fortunately. The toxicity causes excessive hair loss and it causes intense headache, which behaves like a brain tumor sometimes. It's called pseudotumor cerebrae. But these are very, very rare, the toxicity. It may cause toxicity if you have a hormonal problem called hyperparathyroidism. Then excessive calcium will accumulate in your bones and it may cause brittle bones. The bones which will be like karak, like it will be very crispy, brittle, and can break easily because there's too much brittleness. And these are very rare toxicities. By far and large, 1 capsule a day, enough vitamin D supplements, good exposure to sunshine, about 1 hour walk in your veranda on the nice sunshine in the morning, no problem.
So who is liable to take supplements? Because if you talk about like normal people, like who are healthy, they have enough sun exposure, they eat properly. So for whom would you recommend intake of supplements?
So generally, if you are not taking enough vitamin D rich food, but elderly people above the age of 50, they usually have poor intake of vitamin D foods.
Is it especially women?
Even men.
Even men?
You will be amazed, especially considering our lifestyles. You find the man is ready in the morning going to the office or go down or factory or hospital or wherever to work. He goes by the car and therefore not exposed enough. And then in the office he sits in an air-conditioned room, and then when it is 5 o'clock it's the time to go back home, again by car, and then you have very poor vitamin D rich food like cheese and fish and milk. We usually have kuku and chips or cutlets and kebabs and samosas and things. So very poor vitamin D rich food. And you find that amazing. There is an article from India, 200 healthy 50-year plus men were actually screened for vitamin D, and they were found to be osteoporotic.
Men
osteoporosis. We know women develop osteoporosis after the age of 50. These are men who had osteoporosis, healthy 50-year-old men. It's because of our lifestyle. So we need to take vitamin D supplements. We need to get the sun. So not only elderly who are least exposed to the sunshine because they are bedridden, they are sick all the time, they have very minimal exposure to sun, they are sick all the time inside, they should be given supplements for sure. And growing adolescents and pregnant women should check their vitamin D, and any adult. So this is important for everybody. It's universal vitamin. To D or not to D, or to be or not to be, that famous Shakespeare saying, to be or not to be, to D or not to D. I think you have to D all of them.
Very true.
Okay.
As you know, There are very, very many commercials about sun producing damaging effects to our skin, such as premature aging and wrinkles, and so they produce sunscreen, which many of us use to prevent this tanning and the effects of the sun. So does this sunscreen prevent the production of vitamin D in our body?
Absolutely. Sunscreen behaves same as like no exposure to sun. Now sunscreen, there are three things I want to emphasize on sunscreen. One, sunscreen and the cosmetics associated with sunscreen. It's called SP40 or SP60 or something, some chemical. It's a multi-billion-dollar business companies. You can't afford to lose business. And therefore, they will talk about all the harm of exposure to sun, and therefore protect your skin to sun.
And produce sunscreens.
And therefore, you will have peer pressure and you will see the effect of sun. But what's the harm in having a tanned, dark skin which is healthy, instead of having fair skin which is dependent on a sunscreen? Now this is a problem
and
we have.
And to make yourself susceptible to all those diseases you
now,
mentioned.
Now sunscreen itself may be associated with skin damage. Sunscreen itself are associated with certain types of cancers. Sunscreen have been developed more safer. This is more safer sunscreen. This much protection, fine, no problem. But the problem is, one, they are expensive. Number two, they may be potentially toxic. Number three, it reduces your vitamin D absorption. So if you are exposed to a sun which is infrared, not the ultraviolet, so in the peak of afternoon, 1 p.m., you are out in the beach, and those who produce the sunscreens are the ones, I'm not talking about certain communities, but those people who really talk about sunscreen. You want to wear your bikini and you want to be in the sea to get yourself tanned. You want the color, but you don't want the damage. So they put those sunscreens and things, suntan lotions with sunscreens, no problem. But that is because they are going to expose themselves to infrared radiation and not ultraviolet radiation.
Which are two different things.
So sunscreen is protective to those damaging effects of infrared overexposure. For a normal person like me, with my face and my hands and my palms exposed, walking on the street, why do I need to have a sunscreen? At the most, if I want to prevent the glare in the afternoon, then I'll wear a cap. And I'll lower a little bit of my head scarf. And let me be exposed to the sun. In the morning, I will not wear the cap. If I'm wearing that jockey cap, I will just turn it around and just expose myself to the ultraviolet rays and walk in the street. No problem. So sunscreen has got its role. It is not totally bad thing. It has got its role in preventing infrared damage to the skin. But there are when you should use it.
There should be sunscreen-free times as well.
Yes, absolutely. There should be sunscreen-free times. It should be the natural times, the ultraviolet exposure times.
So earlier you mentioned the role of vitamin D and its association with calcium, phosphorus and fatty acids. Now, low levels of vitamin D will be associated with low levels of calcium, right? So what effect does this low level of calcium have in our body?
It's very important. This is the role of vitamin D and bone. I will just quote one study here. It says, in a study which they found fractures of forearm fractures in children. I'm sure out there in the audience, parents have seen many of their toddlers and young children having forearm fractures. You fall on your arms, outstretched arm, all your weight goes onto your arm and you get a fracture. Those who had fractures are those who had vitamin D deficiency and poor bones. So vitamin D helps in mineralization of the bone because it gets your gut absorb all the calcium and it deposits them in the bone. It prevents bone reabsorption of calcium. So this is a study in children. Another study showed that those who consumed normal vitamin D supplements had lowest level of stress fractures. I'll give you example of stress fractures. This is very common. You recall people who go for Hajj. They are very enthusiastic. In Hajj, sometimes you have to walk quite a long distance because of traffic. You rather, oh, let's have a walk and we'll get more sawab in it. Definitely, sure. Or sometimes we take a stride to go walk to Mina, Arafat, things. Then you find after they come back from Hajj, oh, their legs are killing them. They are hurting and paining and like anybody's business. You know why? Because in their calcaneum, in the soles of the feet down there, because you have walked too much and because you are walking with chappals, with slippers, no walking shoes because you can't cover your feet. Because you have to wear chappals which do not cover the dorsum of the upper part of your feet. So they wear chappals and then this calcaneum, the lower part, the heel part, gets stressed and then they develop minute microscopic fractures which are called stress fractures. If you have adequate vitamin D, you don't develop stress fractures. Another example of stress fractures is marching. The military people, if other than their normal drill, if they had to do a huge amount of drill like a punishment or there was a need to do a drilling for marching with their heavy shoes, so they go doom, 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 they get fractures of their calcaneum, the heels. If they have enough vitamin D supplements, they don't get stress fractures. So these are studies, and it also found that old people above the age of 65, if they had adequate levels of vitamin D, their fracture incidence is reduced by 30%, the chances of fracture. So calcium and bone, very important. It is, this is the most important. I told you an example of male osteoporosis in India. And low back ache. In Saudi Arabia, young women between the age of 15 and 40 were studied, and they did vitamin D levels before and after. So all those who had back problems, young 15 to 40, they were done a vitamin D level. Half of them were supplemented and half of them were not. Those who were supplemented, all of them recovered from backache. All of them. So low backache is also related to a stress fracture. This is why I'm putting it here, low backache. Because when you are standing, your whole body weight goes down on the lower part of your back, and then it divides into the two legs. The whole body weight goes there, and then it's divided into two legs, and from the legs it goes down to your heels, and from your heels to your toes. This is how your weight is controlled. So whole weight goes on the low back. If you have vitamin D deficiency, it causes a stress fracture on your spine constantly. And therefore, it's a good idea to have vitamin D in your body. Whether it is from milk, cheese, eggs, fish. Several times in the Quran is described. This is wonders of the world. This is wonder of Allah's creation, fish. And the way the fish has been described, every time when the fish is described, Allah describes fish in a very, very, very beautiful way. That I have given you the flesh which is swimming, a flesh which is swimming. That's fish. Lahmun tariya. And whenever he describes the fish, there is always a description of all the goodies of the earth. The vegetables, the greeneries, the sun, the rain, the clouds. For example, in Surah Fatir, the description of fish and that I have created for you 2 different types of waters. The salty waters, where you will get lu'lu al marjan and the fish, and the sweet water which will quench your thirst, and fish inside. And this fish is for you to eat. So one of the richest source of vitamin D is fish which is fatty, like tuna fish, the sardines, the tuna fish. It's very, very rich in vitamin D. And it's been described that you eat fish. It is food from Jannat, fish.
Even God shows in the Quran how important
it is. Important to eat fish.
Very important.
It has been described several times in the Quran about the cattle, that we have created for you cattle for carrying your burden. At the same time, we have given you a complete wholesome drink. It's milk and food and many other benefits like leather goods, like the bones which are used for making buttons and many other things, and so many other benefits. But milk has been described there. So it's very important. Milk, fish, sunshine exposure.
So another set of our population which is very vulnerable to vitamin deficiency, the pregnant women. So how important is this vitamin D during pregnancy?
Extremely important, and you have touched a very sensitive point. I have been doing some research on not vitamin D related issue, but neurological issues in children. Inshallah, if we will have time, maybe one day we will again talk about those kind of things. But it's something to do with autism. Children who have autism, when records of their mothers were described or studied, it was found that their mother were vitamin D deficient. So a study in Sweden, although they don't wear hijab, but vitamin D deficiency is very, very common, because almost 9 months of the month they don't have sun. And the remaining 3 months where they have sun, they wear sunscreens. So because they are afraid of the sunshine and long summers. So where is vitamin D? Nothing. So when they discovered this in Swedish population, the vitamin D deficient pregnant women and the likelihood of autism, the next day on the counter, there was no vitamin D supplements remaining. They all disappeared. They were all taken away. Full demand. We shouldn't go that extreme. Yes, take vitamin D regularly, so that even when you become pregnant, before even pregnancy, your vitamin D levels are normal. And it's a good idea to have it checked before you embark into pregnancy, and take the supplements. They will not harm the baby. They will increase your calcium absorption, and it's good for the baby, and for the breast milk, and for your bones, and for the stress fractures, and for the growing fetus brain. It's very important.
Because mainly during pregnancy, they mainly recommend the intake of iron and folic acid. Well, the vitamin D is missed out.
That is an important thing. It is now a thing which has to be considered very, very seriously.
Children, after the babies are born, they have got an immunization schedule whereby they're given vitamin A at 9 months and a lot of other vaccines. Would you recommend vitamin D to be given as part of the vaccination schedule?
You know, the way research is going on and the findings which we are seeing, I would not be surprised that we would, instead of, we do give vitamin A with measles at 9 months. I wouldn't be surprised that we should now start also giving vitamin D. When you come to children, recent findings on the last 5 years, it has been found that children who develop ear infections and diarrheal infections, they are vitamin D deficient. Children who have vitamin D deficient are more likely to perforate their ears and discharge pus. Let me come slow on that one. Normally, children who have flu, so don't get confused, don't get panicky.
It's not all.
Normally, children who have flu, they do get ear infections. And with some nasal decongestant, paracetamol, controlling the flu, their ear congestion, and their flu becomes all right. You don't need any drastic measures for treating normal flu. But children who are vitamin D deficient, this ear pain due to flu becomes more severe, and if they are vitamin D deficient, it may even perforate and discharge pus. So they found that those who had perforated ears due to flu were more likely to be vitamin D deficient. So vitamin D deficiency reduces your capability of tolerating your eardrum collagen, you see, the fibers. The collagen are less linked, they are looser, so they break easily, and the ear perforates. And they found very recent articles from Medscape and others, you will find that ear perforation and gastrointestinal infections, vitamin D deficiency in children, therefore, we will have to consider in near future, write this down, in near future, even if I am not there, in next 10 years you will find that vitamin D is incorporated into the immunization schedules.
It's that important.
It's that important. So now in my clinic, I routinely advise a lot of milk, eggs, cheese, these kind of things, and also vitamin D supplements in the form of cod liver oil or any other supplements.
Mainly from what we have been talking about, it shows that this lack of vitamin D is something that has been accidentally or incidentally diagnosed. Like if a person comes with this kind of symptoms, then you might as well check vitamin D. So in order to prevent this kind of diseases or problems that might occur as a result of vitamin D deficiency, would you advise the population that they should go for a regular vitamin D checkup? As in the level of vitamin D in the
Yeah,
serum?
so you would say like, should we all screen for vitamin D? I would say no. But if you have symptoms of unexplained back pain and leg pain and head pain
that
and
doesn't go
this
away
pain and
despite
that
of
pain,
taking medication.
a slightly depressed mood, and you are above 50 years old, then it's better to get your vitamin D checked and bring it up to a normal level. If you have diabetes, if you have any other illness, if you have heart disease, if you have respiratory disease, if you have cancers, any of those diseases are linked to vitamin D deficiency. Get it checked so that you bring back your level to normal. Coming to diabetes, for example, it was found in Australia that those who had diabetes had also vitamin D deficiency. Now, whether it is a cause and effect relationship, we don't know. But if they supplemented vitamin D, the requirements of insulin went down. You see? Again, respiratory infections. So if you have any of the symptoms, chronic cough, chronic bone pains, back pains, feeling lethargic, always weak, always uneasy, then better get your vitamin D checked. In the last 3 months, I checked about 20 people, adults, in my clinic. Although I don't see much adults in my clinic because I'm a pediatrician, but about 20 adults, 6 men and 14 women, all of them whom I suspected had vitamin D deficiency, had vitamin D deficiency, significant. Some of them had to have injections of vitamin D to bring them to normal. It's so serious.
And very prevalent.
And very prevalent.
Despite we would think it might not be because we are under the sun all the time.
So I would suggest all those who are above 50 years, get yourself vitamin D checked, irrespective of men or women.
So how would you diagnose the low vitamin D levels?
So clinically, from when I meet the patient, there will be all kinds of vague symptoms or some clear-cut symptoms of chronic cough, chronic pains and things. But the best way to diagnose it is to do a blood test.
Is there a specific blood test for vitamin D?
And you do a blood test, empty stomach, serum is taken, blood is taken, it settles, and then the liquid part of the blood is tested in the lab for vitamin D3. And then there are cutoff points and values. basically 30 to 100 is normal, below 30 is deficient, below 10 is severe deficiency. We have found patients who had as low as 3.
Severely
And
deficient.
they had eye problems, which is called optic neuritis, and they had to be given injections of vitamin D to cure their eyes. Optic neuritis, a serious inflammation of the eye's nerves. So if you have any of those symptoms, better to get vitamin D checked. And if you don't have any symptoms and your vitamin D level is normal, then maintain your whatever good practice you are doing. Good diet,
Sun exposure.
sun exposure.
How would you prevent vitamin D deficiency?
As you said, prevention is better than cure. So drink milk, at least 2 glasses a day. If you can't drink milk because it's yucky or you don't like the taste or it's boring, then make it flavored, or eat yogurt, or eat cheese, or eat milk-based food.
Even eggs.
Eggs with the yolk, fish, and expose yourself to sunshine at least 1 hour a day by a good nice walk in the morning.
It should be sufficient.
Sufficient, 3 times or 4 times a week should be alright, but daily is even better.
In our whole show, we talked about rickets in children. Would you just highlight on what rickets is?
Yes, rickets is the children's counterpart of what you have osteoporosis in adults or osteomalacia in adults. In children it is called rickets. So the child is growing and therefore all his little small bones, they require to weight bear. All his joints which have got junctures which are always moving, they also require good amount of calcium and deposits. So because of vitamin D deficiency in children, sometimes, rarely it happens due to a kidney disease, renal tubular acidosis it is called, or kidney failure for whatever reason. But most of the time it is due to vitamin D deficiency. Enough calcium is not gone to the body. Blood requires always enough calcium in order to maintain your nervous system. So what will happen? The bone becomes absorbed. The bone becomes absorbed. The bone is denuded of the calcium so that the blood has normal calcium levels.
It's actually trying to stabilize the calcium level in the blood by taking from the bone.
From the bone. So once it takes away from the bones become soft. So all the places where it's supposed to weight bear. So a small little child tries to weight bear with his hands when he's sitting and balancing. Or he starts standing and therefore his knees are required. He's always breathing, definitely. You need your ribs all the time. This is the only bone which moves all the time. Even if you are sleeping, no other bone moves. You are stable. But the lungs, the ribs will always move. The ribs has to move. So you find they have got lumps and bumps all around the rib area, which is called rickety rosary. Rosary, you wear a rosary, a tasbih. So you find bumps. Their skull bone is very soft. Their wrist is very broad. And the bone X-ray shows it's all very porotic, osteoporotic.
Meaning holes?
Meaning it's not very
It's
white.
not dense,
it's
right?
not dense. So these children, they have increased respiratory infections. They develop pneumonia more frequently. They develop
Because of
diarrheal
lowered
disease
immunity.
more commonly, and they remain stunted until and unless you supplement them with vitamin D. So that's rickets, and can be serious because in Africa we found 33% of the low birth weight. Unfortunately, I have seen in my practice in Muimbili, in mentally retarded clinics where I also attend sometimes, And in these clinics, because these children who have cerebral palsy and mental retardation, they are not exposed out in the sun, and they are confined to their houses, and they believe that this might be witchcraft and things, so they don't get to see the sun. They are brought to the clinic. They are in pain all over, because when you hold them, they are in pain because the bones are paining. And you find them grossly vitamin D deficient. It's rickets.
So the effects of rickets as a result of vitamin D deficiency, is it reversible
It's reversible if you supplement them
at the right time?
that time.
Okay. Professor, as we are approaching the end of our show, what advice would you like to give our viewers?
The best advice would be expose yourself to early morning sunshine, at least 1 hour a day. Good sunshine, milk, cheese, eggs, tuna fish or any other fish. And if you have any vague symptoms, if you have any disease, even if you are sick, if you have blood pressure, heart problems, diabetes, bone problems, cancer, God forbid, all those conditions, any of those conditions, even infectious conditions like tuberculosis, better you get yourself vitamin D tested so that you are supplemented, so that your treatment also becomes easier to uptake. So prevent yourself from vitamin D. Do what I said, exposure to sun, vitamin D rich food, and get yourself tested.
Thank you so much for coming
Okay.
to our show.
Well,
Professor, I'm sure our viewers have learned a lot about not hiding themselves inside, not using over sunscreens, and eating healthy.
And eating healthy. That's right.
Thank you so
Thank
much.
you very
Good
much.
afternoon.
Good afternoon.